Do they affect kissing? Well, I can't be sure because I don't have All-On-4, but from what I hear is that the quality of life and basically normal function is completely restored, and patients are able to kiss as much as they like, and I believe as well as they can. That's actually a good question because the teeth are positioned in a certain way which really optimizes the outcome for aesthetics and function. But you know, some people can't whistle even if they don't have All-On-4. So when you restore their teeth into the right spot, whistling can become a problem, but in most patients I find that they can still do that really well. I don't know if there's such a thing as too perfect, but if you mean fake, this is something we try to avoid. So it takes a lot of effort, and we use digital design to make sure that the implants and the immediate final teeth that are fitted on top of it suit the face. If you have a specific desire to make them look imperfect, then this is something we have the absolute flexibility to do because we operate on a clean canvas. Some people ask for tooth gaps because it's them, or they've seen celebrities like Madonna, for example, with a tooth gap, and they think, hey, I want what she has. We can create exactly what we want, what the patient wants, and that can mean perfect teeth and also introducing imperfections to make them look as natural as possible. Let me crush this myth right now. Dental implants do not activate airport scanners. The implants are very small. Also, the titanium material or zirconia material is not magnetic. So that's not going to activate the alarm in an airport. If something does happen, tell the guard that you have implants, and I'm sure they'll be able to overcome that in one way or another. It's possible whenever getting new teeth, because of the changes of the form and the aesthetics and all of that, it is of course possible that you might bite your tongue a little bit more compared to what it was before, because the space could be a little bit more restricted compared to when you had dentures or deteriorated teeth. So you could potentially bite your tongue a little bit more, but it's not really a complaint that I hear. The All-On-4 Plus treatment with immediate final teeth is a secure and a fixed replacement of your teeth. They do not feel loose and they are not loose in your mouth. The teeth are fixed to the implants and you use them like your natural teeth. I think if you don't clean your teeth, you're going to have some sort of smell coming out of your mouth, sometimes unpleasant. It's also important that if you have implants, that they're positioned correctly to enable you to clean properly. So can they smell? Yes. Is it your fault? Most of the time. But sometimes it can also be the way the implants were done. The noise from chewing with the All-On-4 Plus dental implants is almost no different to the noise you would get from natural teeth. There are situations where certain materials can feel a little bit noisy. For example, harder materials, if we use zirconia on top and bottom, you could have a clicking sound. That's a problem. That's why we don't actually do zirconia restorations top and bottom. If we ever have to do a zirconia type of restorations, it's only going to be either on the top or the bottom. But in terms of clicking sound, like you would hear from dentures, this is not something that happens with the All-On-4 Plus treatment. There are different materials. Some materials are heavier than others, but in the mouth, once they're tightened and they're fixed and they're part of you, you don't actually feel the weight. In my experience, and when the implants are done correctly, I find that it's very rare that patients are dissatisfied with the outcome. We go through a lot of effort to do a digital smile design to make sure that the teeth look natural in the mouth. So it's very rare for patients to say to us that, hey, I hate my teeth. But sometimes they might not like certain aspects of the teeth. I've actually never had a patient saying my teeth are too white, but sometimes patients regret not having the teeth a little bit lighter. The nice thing about our process and what we do is that even if you absolutely hate them, if there's something you don't like, it's very simple for us to remove the teeth from the frame that holds them and then create a brand new set so that we can completely redo the entire smile again. But if we need to do that, I usually tell patients, let's wait for 4 months. Let's see how your face settles in. And quite often when we do that, by the time they come back after 4 months, they love the teeth and there are no changes that are required. But if necessary, it's absolutely possible and simple to change the entire set.